Hello, my name is Megan Anderson. I am a women's health nurse practitioner who also has over a decade of experience working in functional medicine. And the question that we get a lot is, what is functional medicine? How does it differ potentially from conventional medicine or naturopathic medicine? And so I really like to describe it with this framework that I think a lot of people can resonate with. So I like to use the acronym called FLIGHT. F stands for food and nutrition. So thinking about your diet, what's coming into your body, what foods might be inflammatory, all of that is super important. Then L stands for lifestyle. So that's everything from movement to sleep quality to stress management, relationships, all of that. Those are things that we can't change for you, but we can certainly talk through and work on modifications if something is really driving a lot of inflammation in your body coming from your lifestyle. I stands for inflammation and infections. So inflammation is such a buzzword, but the truth is so many people in our modern day are quite inflamed. And so looking for the sources of that inflammation is really, really important so that we can start to bring that down. Next is G. G stands for gut. As many of you probably know, most of your immune system, about 70, sometimes people say 80% of your immune system is in your gut. And so you might not have super overt digestive symptoms. And yet, if there's autoimmunity, if there's thyroid imbalance, if there are other signs of inflammation, I'm probably going to suggest that we do a little bit of gut testing so that we can explore whether or not there are any underlying gut infections or dysbiosis or healing that needs to be done. H stands for hormones. So Anazao, of course, is very well known for our support of both men and women and hormonal balance and hormonal optimization in general. We see a lot of symptoms of low hormones, but also I treat things like PCOS, endometriosis, etc. And then last but not least, T stands for toxins. So in my world, we all know that we're exposed to a lot of toxins. Some we can have control over, some we cannot. But the two that I see the most typically are mycotoxin burden that comes from mold exposure, could be current, could be past mold exposure, and then heavy metal toxicity. So I'm going to ask everyone about amalgams, seafood, glyphosate exposure, that kind of thing. So FLIGHT is a really good way to conceptualize what functional medicine means and the conversations that we might have if you're interested in exploring some of your symptoms or even diagnoses. I don't care so much about those labels. I care about what got you there and what we can do to get you out of that and feeling your best. So I look forward to meeting you.